Open enrollment for the Affordable Care Act marketplace starts November 1st. And if you're one of the roughly 140,000 Iowans who get their health insurance through it, you're probably noticing your costs are going up. Way up. I'm Zachary Oren Smith. I write about politics for Iowa Starting Line. Here's what happened. Back in 2021, Congress expanded the ACA's premium tax credits. Basically, they made health insurance way more affordable for the millions of Americans who receive it. Those subsidies got extended in 2022, but they're up to expire at the end of this year. In Congress, they're at a standstill. That government shutdown that you've probably heard of, Democrats want Republicans to agree to extend those subsidies to keep premiums from increasing by truly absurd amounts. Republicans like U.S. Representative Mariannette Miller Meeks say,
I think that's an unreasonable demand.
Lori Hunt would disagree. She's lived in Iowa her whole life, 5 or 6 generations deep. 3 years ago, she was diagnosed with breast cancer at the age of 50. Surgery, radiation, the whole ordeal.
It's not exactly how I was kind of hoping maybe to go to Napa or something, but but that's where we are.
Earlier this year, Lori got laid off. When you lose your job, you lose your health insurance. And when you're a cancer survivor who needs regular screenings and medication, coverage isn't a nice to have. It's a necessity. So she went to the ACA marketplace and found a plan she could afford. With the enhanced tax credits, her premium was less than $10 a month. Without those tax credits, she says her plan will cost her more than her mortgage.
There's no way I could have afforded that at all. That's just unattainable.
And it's not just Lori. According to Kaiser Family Foundation, if these subsidies expire, the average marketplace enrollee will see their premium increase by more than $1,000 a year on average, a 114% increase.
Our whole congressional delegation ran on the whole thing about lowering costs for Iowans. Right now, we're sitting on this big time bomb of a big thing that's just going to explode, and we're not even saying anything about it.
And so what happens if subsidies expire and she can't afford her premiums?
So basically, I can't afford it. I won't be able to buy it. So basically, I joked before, my insurance policy will just be thoughts and prayers.
She won't be able to see her doctor unless it's an emergency. She might be able to get her cancer medication through a discount card, but regular screenings, preventative care, forget it. And this isn't theoretical. This is happening in 2 months unless Congress acts. And here's the thing. You can't just decide to not get health care, especially when you're a cancer survivor or pregnant or trying to get treatment for substance abuse. Open enrollment starts November 1st. If you get your insurance through the Affordable Care Act marketplace, understand that your costs might look very different than they did last year. And maybe, just maybe, call your representatives and ask them what they're doing about it. For Iowa Starting Line, I'm Zachary Oren Smith. Thanks for watching.